When UN is mentioned in terms of COVID-19 crisis, my first impressions concerning North Macedonia are World Health Organization and purchase of ventilators. Am I on the right track here?
So the World Health Organization is the lead organization on health, and they've definitely been active. First of all, they've been working in the country for 20 years plus, but they've also been active on the COVID-19 since early January on preparedness and response. We do have a larger UN family that has been working around some of the procurements of these emergency medical equipment. So in addition to WHO, which has been active since the beginning, getting the COVID-19 tests and a lot of other materials, we've also been coordinating quite well the UN agencies and with the government, with the Ministry of Health and obviously the Secretariat for European Affairs. In terms of the equipment that we're buying, the equipment that most people are aware of is, of course, the ventilators and the personal protective equipment. And we have a team of UN agencies. We have UNOPS, UNDP, UNICEF, UNFPA, and WHO that have been working in a coordinated fashion to work with the Ministry of Health to acquire these important COVID response products.
Here we are talking about UN help in immediate response measures. What about your involvement as UN in mitigation of crisis effects on longer term?
So we've also started working on the socioeconomic effects. And essentially the type of work that we're doing is, again, closely with our partners, looking at the vulnerable groups, looking at employers and workers, looking at all the different aspects of the impact of the crisis. And this, as I was saying, in a coordinated fashion with the Ministry of Labor and Social Policy, with all of the different ministries, line ministries involved. But it's definitely something that as the UN, with the different technical areas of expertise that we have, we work directly with our partners. For instance, we have the Food and Agriculture Organization working directly with the Ministry of Agriculture. We have a lot of these industries that have been affected in the country, agriculture, textile. We're doing socioeconomic assessments, trying to get data and facts so that we can then design appropriate responses.
Almost all analyses say that COVID-19 is going to stay in the coming months, maybe years. So what would new normal look like according to UN perspectives?
So I think we have an opportunity to define the new normal. What has happened over the past several months has made people rethink the way they work. People that were not used to working at home have had to find ways to work at home, to digital solutions. And in this country already, there was a lot of talk about digitalization. Well, now we've had a few months to see what does that really mean. It also means that we have a chance to see what kind of challenges did we have while we were trying to be creative and keep businesses and the different parts of society running. We've been exploring different digital solutions. We now have an opportunity to say what worked and what didn't. We can redefine how the new normal looks. Also, one of the big things that's been in the public attention has been pollution, because so many industries closed and so much traffic, and both airline traffic and car traffic was reduced, that we've seen an important difference on pollution. There's been different ways that you've actually been able to incentivize people to stop using cars and transport. This country already had a very high rate of people who biked to work. But I think in other countries around the world, there's a way to encourage people who maybe are hesitant to take public transportation to walk, to bike. And the new normal also means that maybe people are going to continue to do that even after there's more relaxation of measures. And this is an opportunity for us to be more friendly with the environment, learn from some of the challenges that we had and see what we need to do to adjust. I think we can have a chance to build back better, to be more resilient this time. We've seen vulnerable groups. One of our focuses is obviously vulnerable groups, but many of those vulnerable groups have actually shown that they can be quite strong. We work with, obviously, children, women-led households, and people must remember that women are also the ones that are often caregivers. In the case of COVID-19, being a caregiver is also a possibility for vulnerability. But we've also seen that people are willing to, the communities have come together to work together. I think that having more global solidarity is an important part of building back better. Also regional, how the different countries in the region manage to continue to work together to keep the societies functioning. I think there's been a lot of lessons learned here, and the building back better gives us an opportunity, more digital solutions. finding things that are sustainable in terms of the environment, lower pollution. I think, like I said, that there's opportunities also for communities to learn how did communities within themselves manage to take care of each other in terms of if you have a neighbor that was under quarantine and they needed support in terms of getting food or assistance, the communities realize that, yes, it's true what they say, global solidarity, but local action is what you need.
Has UN any plans, any strategies for the future to prevent global situations like this one?
I think from every emergency and crisis, there are lessons learned. And I think I already mentioned global solidarity. We've seen what has happened recently with the development of a new vaccine, that we have seen countries around the world, I think I heard 8 billion euros were pledged to see that people are working together to find a vaccine for this. I think in the future, learning lessons about how different communities can come together, also how you can coordinate within the country, and also the quick implementation of the prevention and mitigation. I think that was one of the success stories in this country, to quickly put in place the mitigation measures in terms of containment of the virus and tracking. So I think definitely when you see what we have and what we've learned, you can definitely continue working on prevention.